What's going on, guys? Welcome back to A Couple Nurses. This is Cordero. In today's video, we're going to talk about some of the tips and tricks and things that I suggest that you should be learning as you start to enter clinical training as an SRNA. So I've been in clinical training for about 9 months, and I only have 9 months left before I graduate and take boards to become an actual CRNA. And today I'm just going to go over 3 specific things I think can help you as you begin entering clinical training as a SRNA. Before we dig into the rest of the video, be sure to like, share, subscribe, put Nurses Rock down in the comment box if you find any value in today's video, and also check out acouplernurses.com if you want any of our Presidex and Chill gear. So one of the first things I think you should really start to practice once you get into clinicals is you should start to pre-op your patients, get comfortable coming up with your own script. Everyone has their own spiel about how they like to pre-op their patients, but this is pretty much asking the patient any relevant medical history, and then we're also explaining the plan of care for anesthesia for them, along with the associated risks. As you start to get these reps in early, you really kind of get the jitters out of being nervous in the OR and the operating room environment. So, we've been talking to patients as ICU nurses, so this kind of gets you back into the flow and gets you a good rhythm once you get into clinicals. And the next thing you really want to focus on is tailoring your anesthetic. So early on, we do a lot of care plans as SRNAs, but these care plans are really beneficial as you go forward as an anesthesia provider. We're tailoring our anesthetic based on the patient's age, based on their comorbidities, based on the medications that they're taking, based on the severity of their comorbidities. We're also tailoring our anesthetic based on the type of surgery it is. How long are these procedures? Is going to determine what kind of medications we use and the doses of medications that we use. Is there expected that there's going to be a lot of blood loss? Are they going to be doing any kind of neuromonitoring? Does the patient need to be awake quickly after surgery? These are a lot of things you want to be thinking about as well. Is this a robotic case or a laparoscopic case where the arms are going to be tucked? Is the patient going to be in Trendelenburg, which may affect our hemodynamics, which may affect our patient's ventilatory status and what's going on with our ventilator. So these are just some things you want to be thinking about and really focus on honing that anesthetic plan towards all of the subjects we just went over. And the last thing you really want to be focusing on is having some grace with yourself. Be patient. Really think about your emotional intelligence in the operating room. There's going to be days that are great. You're going to be feeling like you're on cloud 9. There's also going to be really hard days in clinicals where you're just tired all week from, all of the schoolwork you have to do, from the very sick patients that you've had to take care of. And not every day is going to be great. So really just have an understanding, get up and show up the next day. Some days all you can do is show up and try to put a smile on your face. Also, as you start to get further along in your clinical training, you will start to develop your own way of doing anesthesia, certain medications you like, doses that you like, certain ways you like things set up in the operating room. And then you may work with someone who does things completely different. And have that emotional intelligence and awareness to understand you are still training. This is this CRNA or anesthesiologist patient as well. And just be open to whatever they have to say, right? A lot of these people have been doing anesthesia much longer than we've been doing it. So, have in the back of your head, I like to do my anesthesia this way, but I'm willing to do it this way today. And that'll save you a lot of beef and a lot of tension that can arise in the operating room unintentionally. Quick video, guys. Hope you guys found some value in this. I'm only going to be making videos based on what you guys tell me you want videos on, so be sure to put any kind of suggestions or any kind of content you want to see down in the comment box. But yeah, we'll see you next time. Peace.